Good morning at the end of a long couple of weeks of budget bills. We're grateful that you're here. I'm Erin Murphy. I am a state representative and a registered nurse, and we're here today to talk about the last of the budget bills, which is Health and Human Services. We began this session talking about health care. We began this session talking about the individual market. And twice now, the legislature has appropriated significant sums of money to subsidize the health insurance market. That totals $824 million, leaving very little left for the Health and Human Services budget. Speaker Doubt gave this committee a $600 million cut target, $600 million of cutting, which looks in this proposal to be two payment shifts, and in the fine print, $204 million provider rate cut that's contingent on other ideas in the bill. What is sacrificed as a result of that are the people who get their care from home care workers, the people who get their care in the security hospital, those people who are doing child care across the state of Minnesota. There are real consequences to this proposal. It's not a very good proposal. And it is because this legislature, the Republicans, have favored tax cuts for the wealthy, $1.3 billion now in tax cuts, $800 million to health insurance companies. And because of that, the people who are doing the work across the state of Minnesota, people caring for our children, people who are caring for the mentally ill, people who are caring for the elderly and for the disabled, are sacrificed, left high and dry, doing a very hard, sometimes very rewarding job, but not for much pay. And they're the ones that are paying the price in this bill, and that's what we're going to talk about today. I would like to introduce next my colleague, Peggy Flanagan.
Thank you, Representative Murphy. My name is Peggy Flanagan. I'm the state representative for District 46A, and I had the pleasure of serving as the DFL lead on the Child Care Subcommittee that was formed this year. We traveled across the state, listening to Minnesota families, listening to providers, to child care providers, about the real need for investment, in particular the need for investment in the child care assistance program, both to ensure that we're reducing the waiting list, which often has over 5,000 families who are waiting to access child care. These are families who want to work, and the obstacle of expensive child care is keeping them out of the workforce. And the other folks who have been impacted by our lack of investment in the child care assistance program are child care providers and workers themselves. And right now, the CCAP, the Child Care Assistance Program reimbursement rate, is less than 25% of the market value. So we've got folks who need that 25% provider reimbursement rate, and it's something that has been bipartisanly supported. We had bills that came out of the Child Care Subcommittee that did just that, helped reduce a waiting list and help give some support to workers. And I'm incredibly disappointed that they were not included in the Health and Human Services package that was offered up by Republicans and what we'll be voting on today. So we've got a lot of work to do. Minnesota children and families are depending on us. Child care workers are depending on us, and the Republican bill has let them down. Thank you.
Good morning. I'm Diane Loeffler. I represent District 60A in Minneapolis, and I'm going to share with you what's going on with our home and healthcare, home and community-based workforce problems. Minnesota is facing and is in the midst of actually a crisis in the workforce for home and community-based services. These are the services that keep people with disabilities and frail elders living in the community, getting up, going to work, participating in a life of satisfaction. But all of us could be there tomorrow. It only takes a car accident to suddenly find your life transformed. And if you are dependent upon someone to wake you up in the morning and get you literally physically out of bed, help you bathe, get dressed, and get to work, or to coach you on a new job, your life is thrown into crisis when these positions aren't filled. Right now, there's plenty of evidence of the problems of this. There are over 9,000 vacancies statewide just in services for people with disabilities. That's a significant loss in all parts of our state. There is, at this point, an increasing amount of complaints to the Department of Health and errors being committed. And having just put in a 16-hour day, I can tell you people are routinely doing double shifts. And I can feel that I am not, after 16 hours yesterday, feeling like I should be entrusted with medication management for a group of people with really fragile health. And, but that's routinely done by people in this field. And the complaint growth and ability to respond to that has been really strained. And we're also under federal court supervision on implementing our Olmstead plan to get more people living more independently in our community and working in competitive wage jobs. And that's going to take a lot more of these workers. Their average wage is $12.32 an hour. They can't compete with retail jobs all throughout the state, we heard. And investing in a raise for these workers would improve care for our loved ones and attract more people to this field. Without it, we're going to end up with people going to more expensive situations, to nursing homes, to more group living situations, assisted living, and losing their jobs. We've heard from people who cannot get to their jobs because they have not been able to have reliable assistance getting up, getting going, and getting to their workplace in the day. So it's incredibly disappointing that in this time of crisis for so many people who depend on others to have a successful life, we didn't have any rate increase and wage increase put in for these people. And I'd like to turn this over to Jack Considine, who is going to talk about another topic.
Considine. After several years of horrific injuries, of meetings with the governor, there's not a dime in there for the security hospital and their needs. This is appalling. It is reprehensible that we are putting vulnerable adults in a situation where they are exposed to assault. It is appalling that we are not backing up the staff and giving them what we need. This is a unique population. It is extremely dangerous. Worked there for 6.5 years. I won't go through a list of my injuries, but my wife would get hysterical when I got home early because it meant I was hurt again. We have to support our state workers, and if we're not going to do that, we're going to lose what is our front line in the severe and persistent mentally ill. Thank you. Tina Liebling.
So, good morning, everybody. State Representative Tina Liebling. So I'm going to talk with you a little bit about what this bill does with our healthcare marketplace. So MNsure, our healthcare marketplace, is repealed in this bill. So we all know, Minnesotans know, that in Washington, D.C., Republicans are taking whacks at healthcare. They're taking whacks at people's ability to get health insurance. They saw the debacle. They saw Republicans could not agree on how best to whack healthcare, but they know that it is not, the effort has not gone away. So we're in a tremendous time of uncertainty. In this uncertainty, this bill repeals our state exchange and sends Minnesotans to the federal exchange with all the uncertainty that that would involve. But even worse than that, the bill cuts funding that is necessary for counties to continue to do eligibility determinations. Counties in Minnesota have the responsibility to decide who is eligible to get on our state healthcare programs. So at the same time, the bill Republicans are very concerned about making sure that only eligible people get on our programs, and we are all concerned about that. They are taking away the ability for counties to make sure that that actually happens. So I think of this as taking a tricycle, like a child's tricycle, and making it into a bicycle by just ripping off one of the wheels. Doesn't work. You can't ride on the other two wheels. That is what the Republicans are doing in this bill that is before us. They're saying, let's send Minnesotans to the federal exchange with all of the uncertainty that that entails, and then the money that we're using to continue to build out our eligibility system here in Minnesota, they're going to take that away too, and think that somehow that builds a system that people can use to get health insurance and ultimately to get health care. And that just doesn't work. So this is a very troubling bill, and we're going to fight like heck against it. Thank you.
Any questions? If not, then we'll see you. Have a great week off. Okay, all right. Thank you.